Hi, I'm Florence. I'm the Osteopathic Manual Practitioner here at Proactive Pelvic Health Center, and today I'm going to talk about newborn tongue ties, and I'm going to show you some stretches but also some mobilizations that you can do with your newborn should they have a tongue tie at home. So a tongue tie is essentially a really restricted or tight lingual frenulum. We all have a lingual frenulum. If you lift up your tongue, you'll see that band of tissue, sometimes a little bit white. That is your lingual frenulum. It's what allows us to have free movement of our tongue, but it also provides our tongue with a lot of stability, which allows us to eat, to speak, to swallow, and it plays a really important role in breastfeeding. So an infant who has a tongue tie may have difficulty breastfeeding. So typically when an infant has a tongue tie, we tend to see a lot of tension throughout the body. That means through the shoulders, through the chest, potentially in the hips, a lot of closed fists. And what's super important to help with releasing that tension is going to be stretching, but also some more dynamic, active mobilizations. Body work like osteopathy is super helpful and often recommended for infants before they have a tongue tie release and afterwards. The aftercare is what's so important should your newborn or should you opt to have the tongue tie released. Because they have that tendency to have global tension, you need to work on releasing the body as a whole and not just the tongue itself. I want you to know that the tongue should be evaluated for its anatomy, so how it looks and how it appears, but also for its function. So does it negatively affect the function of the tongue? That is super key. If it doesn't affect the function and breastfeeding is painless and baby is growing and you are thriving, then you likely don't need or wouldn't really benefit from a tongue tie release. So when it comes to stretches, I focus a lot on opening through the throat, through the chest, kind of stretching through the neck and mobilizing the shoulders, releasing tension through the shoulders and the neck. So let's move through a few exercises that you can do at home with your newborn. First, I'm going to show you some ideas for just releasing tension through the body as a whole. So I like to do baby disco, or grabbing opposite arm and bringing opposite hand to opposite knee and just switching back and forth, crunching in and then lengthening away. Snow angels are another favorite, so bringing the arms up above their head and down, up and down. Or just shoulder circles, gentle shoulder circles, just to release any tension through their shoulders, their necks, and just to get them to relax. Then this might be familiar to you if you have a gassy baby. So bicycles or just a double leg press, pressing the knees in towards the chest and away, just softening through the pelvis. And then last, pelvic tilts or pelvic rocks, as I like to call them, just lifting the pelvis from side to side and just shifting them around. Now, active tummy time, or just tummy time in general, is going to be really helpful for opening and lengthening the front of the neck. You can take it up a notch by grabbing one of their favorite toys and playing what I like to call blind spot checks. So having them track the toy from side to side.